Hello, and thank you for joining us. My name is Sarah Yacoub, and I'd like to welcome you to the CDC Partner Update Call on COVID-19. This call serves as a way for CDC to share weekly updates on the COVID-19 situation and our latest resources and guidance, especially for our private sector and other partners. Our topic of focus today is on the considerations that sports programs can keep in mind as they are thinking about scaling up operations in the time of COVID-19. This includes questions that are relevant to athletes, coaches, and staff at all levels of play, from children to adults, as well as amateurs to professionals. We also plan to cover information relevant to those managing sports venues, such as stadiums, and to those hosting large events. This call is not intended for media. Media can direct their questions to media@cdc.gov. This call will be recorded and later posted on the CDC COVID-19 website, as well as on YouTube. Before we begin, I'd like to remind all participants that the CDC website has the latest information, guidance, and communication resources. There are over 1,500 documents providing information and guidance for individuals, businesses, and the public on this website. Since we last facilitated a Monday partnership call, some examples of resources that have posted include Resuming Business Toolkit, COVID-19 Employer Information for Office Buildings, Interim Guidance for Mass Transit Operations, What Construction Workers Need to Know About COVID-19, and Interim Guidelines for COVID-19 Antibody Testing. Today, our plan is to hear general updates from our response leadership, followed by comments on considerations for sports programs. We'll then have ample time for Q&A. Speaking of Q&A, thank you to those who sent questions in advance. We tend to take those questions and tee them up in preparation for today. And I'll also be keeping an eye on the Q&A box, so please feel welcome if you've got any questions that come to mind to take advantage of that box. There will be no content slides during our speakers' remarks or for the Q&A session. So what you see on your screen right now will remain for the duration of the time. However, there will be a transcript that provides all of the remarks that are made that will be posted both online and onto our YouTube account. I'm pleased to be joined today by three CDC experts, Dr. Grant Baldwin, Dr. Dill Doughty, and Dr. Ken Mead. Dr. Grant Baldwin is the co-lead for CDC's COVID-19 Community Intervention and At-Risk Task Force. Dr. Baldwin is also the director of the Division of Overdose Prevention at the National Center for Injury Prevention and Control at CDC. Dr. Jill Doughty is subject matter expert for the CDC Sports Guidance. She's an epidemiologist currently serving on the COVID-19 Community Guidance Team. And Dr. Ken Mead is a senior research engineer on CDC's COVID-19 Worker Safety and Health Team. He is also chief of the Engineering and Physical Hazards branch of the National Institute for Occupational Safety and Health, also known to some as NIOSH. I'd like to now turn it over to Dr. Baldwin for some updates.
Great, thank you, Sarah. As she said, my name is Grant Baldwin. I co-lead our Community Intervention and At-Risk Task Force. So in my life outside of work, I am a huge sports fan. My wife, son, and I regularly attend a variety of professional, collegiate, and minor league sporting events here in the metro Atlanta area. And prior to the pandemic, I would say we were at least a game a week. I'm also an athlete. I compete as a master's level racer on a cycling team here in the area. I share this with you to let you know how important sports and athletics are to me. I understand the power of sports to bring people together and the draw of competition. I also know the economic engine they provide. So in this call today, we will touch on considerations for sports, both for attending a sporting event as a spectator or participating in an event as a player or staff member. The same precautions and protections largely apply at all levels of sport, with some variability, of course. Across America, states and localities are experiencing different stages of the COVID-19 pandemic. With this backdrop, many states and local officials are moving gradually and strategically towards reopening their communities. At CDC, we are working to provide guidance and tools to assist state and local partners and other stakeholders in making decisions about establishing and adjusting mitigation strategies to protect the public's health. Community mitigation involves actions that people and communities can take to slow the spread of respiratory viruses like SARS-CoV-2, the virus that causes COVID-19. Mitigation actions are designed to protect all individuals, especially those at greatest risk of severe illness, while also minimizing any negative impact of these strategies. All of the considerations we are about to share are aimed at helping us more safely coexist with COVID-19 until a vaccine or therapeutic drug is widely available. Decisions about the level of mitigation required should be guided by the extent of disease transmission within a community, demographic and other community characteristics, and by public health and healthcare system capacity. State, local, tribal, and territorial officials really are best positioned to help inform these decisions while also addressing the economic, social, and secondary health consequences of COVID-19. Decisions and strategies about how to operate are implemented at the state, local, territorial, and tribal levels because every locale is different and individual jurisdictions have the authority and the local awareness to protect their communities. CDC's community mitigation guidance gives sectors and communities choices while at the same time calling out inherent risks associated with those choices. The bottom line is that the more people an individual interacts with at an event, whether as an athlete, coach, staff member, or spectator, and the longer that interaction, the higher the risk of COVID-19 spread. It's important to recognize that the underlying and ongoing levels of COVID-19 transmission in a community will influence the risk too. Additionally, successful community mitigation involves stacking best practices with several layers of actions to reduce the spread of COVID-19 and lower the risk of another spike in cases and deaths, including at sporting events, regardless of if these events involve spectators or not. Each intervention alone confers some protection. So some of these best practices include washing your hands often with soap and water for at least 20 seconds, or using hand sanitizer that contains at least 60% alcohol if soap and water are not available. Maintaining at least 6 feet of physical distance between yourself and others when outside of your home. Avoiding close contact with people who are sick and staying home if you get sick in accordance with CDC guidance. Cleaning and disinfecting frequently touched surfaces often, and using cloth face coverings in community settings when physical distancing cannot be maintained. It's especially important to practice these behaviors at what we call key times, or times when your risk of exposure might be elevated. So for example, washing your hands with soap or water or using hand sanitizer after exiting mass transit upon arriving at a venue, or using a cloth face covering when attending an event where maintaining social distance is harder to do. So when thinking about holding a sporting event, whether at a local high school or at a large facility with a professional sports team, there are a number of factors to consider and to account for. And these include the overall number of attendees. So larger gatherings of people offer more opportunities for person-to-person contact and therefore pose greater risk of COVID-19 transmission. Are there ways to minimize close person-to-person contact? Are there ways in which to significantly reduce the number of participants or hold the event over several days? The number of people attending who are at greater risk of more severe illness after contracting COVID-19. So older adults and persons with severe pre-existing health conditions are thought to be at increased risk. So how might you consider instituting precautions to protect those at greatest risk? And finally, the level of transmission in the community where it's being held, and the level of transmission in areas from which your attendees will travel from. Large events and mass gatherings can contribute to the spread of COVID-19 in the US via travelers who attend these events and introduce the virus from other communities. So one way to view the risk of COVID-19 spread is by stratifying it. The lowest risk is when sporting events minimize the number of spectators and there is limited or minimal community transmission in the area, and there are no spectators from areas with higher transmission. Greater risk occurs when sporting events limit the number of spectators and are held outdoors and put in place protocols to maintain social distancing, proper cleaning and disinfection, the use of cloth face coverings by spectators and staff, and some of the other precautions I've already mentioned. The underlying community transmission in this case is minimal to moderate, and only a small number of spectators are from areas of higher transmission. And finally, Higher risk occurs at indoor sporting events with an even larger number of spectators, where some of the precautions identified above are only loosely followed. The underlying level of community transmission is substantial but controlled, and there is a moderate number of spectators from areas with higher transmission. And finally, the highest risk is when there is substantial and uncontrolled community transmission, and the event is held without implementing any of the health and safety precautions identified above. And many spectators are from areas with high transmissions too. So there are specific precautions you should consider for food service, use of physical barriers and guides, seating arrangements, and educating attendees about these precautions. But I don't have time in my opening remarks to attend to them, but we'll try to do so in some of the Q&As. So at its core, our ability to prevent new infections depends on two things. First, reducing the rate at which someone infected comes in contact with somebody not infected. And second, reducing the probability of infection if there is a contact. So organizers should continually assess, based on current conditions, again, whether to postpone, cancel, or significantly reduce the number of attendees for events, and robustly implement strategies shared here and further outlined on the CDC webpage. Sports are really a core part of my identity, both watching events as a sports fan and competing directly against other athletes. I can't tell you how much I miss it. But these are unprecedented times, and protecting public health is paramount, while we also do not lose sight of the other impacts. We all understand that and are making these needed changes. So thank you for all that you are doing to keep everyone safe and healthy. Together, we can do what needs to be done. We can cheer on our local and professional sports teams as a spectator. In doing so, we simply need to take the necessary precautions to protect ourselves and others, especially those most vulnerable for severe outcomes, and to be attentive to the current level of community transmission. So with that, I'm going to turn it over to my colleague and subject matter expert on our youth sports considerations, Dr. Jill Doherty. She will outline those considerations and discuss how they might apply to participation in sports across the lifespan. Jill?
Thank you so much. As Dr. Baldwin just mentioned, CDC is continuing to provide tools to assist partners in making decisions about how to protect their communities. CDC has released several guidance and considerations documents that are relevant to sports programs operating as safely as possible during the COVID-19 pandemic. I want to highlight a few in particular that you might be interested in. For all audiences, you might want to look at our considerations for youth sports, our interim guidance for gatherings and community events, our interim guidance for businesses and employers, business frequently asked questions, and decision tool for workplaces. For swimmers and divers specifically, we have considerations for aquatic centers. I also want to note that on Friday, May 22nd, CDC held a stakeholder call that was focused on youth sports leagues. While the call was tailored to a younger audience, much of the guidance and the questions and answers apply to all ages. So you can find a recording of that call on our website and also on the CDC's YouTube channel. So today I'm going to highlight just a few considerations that can be applicable to both adult and youth sports organizations. Additionally, more detailed information is available on CDC's website. So first, to reiterate what Dr. Baldwin noted, a general principle to remember is the more people that a person interacts with, the closer the physical interaction, the longer the time of that interaction, and the more sharing of objects, including sports equipment used by multiple players, the higher the risk of COVID-19 spread. CDC's guidance for operating during the COVID pandemic generally falls into 4 topic areas: promoting behaviors that reduce spread, maintaining healthy environments, maintaining healthy operations, and preparing for if and when someone gets sick. The behaviors that sports organizations can promote to reduce the spread of COVID-19 among athletes, coaches, sports officials, and others are the same actions that all people should be practicing. This includes following healthy hygiene practices, for example, washing hands often and covering coughs and sneezes, staying home when sick, practicing physical distancing as much as possible, and using cloth face coverings when physical distancing cannot be maintained. To maintain healthy environments, sports programs and organizations can consider cleaning and disinfecting frequently touched surfaces and shared objects and equipment using the CDC and EPA guidance for cleaning and disinfecting for businesses, public spaces, workplaces, schools, and homes, and potentially modifying layouts to promote physical distancing. Considerations for maintaining healthy operations include designating one person to be responsible for responding to COVID-19 concerns, and additionally, sports organizations can consider conducting daily health checks of coaches, officials, staff, and players. Finally, sports organizations should plan for the possibility of someone becoming sick. This includes ensuring that coaches, staff, officials, players, and families know that sick individuals should not attend practices or games or other group activities. In the event that an employee is suspected or confirmed to have a COVID-19 infection, it also means doing the following in consultation with state and local health authorities. First, determining which employees may have been exposed to the virus and may need to take additional precautions. Second, informing employees of their possible exposure, but maintaining confidentiality as required by the Americans with Disabilities Act. Third, instructing potentially exposed employees to stay at home for 14 days and self-monitor for symptoms. And fourth, follow the CDC guidance for closing off affected areas and cleaning and disinfecting them appropriately. Now I want to turn it over to my colleague, Dr. Ken Mead, for a few comments.
Thank you. As Drs. Baldwin and Doherty indicated, there are many ways in which the guidance for youth sports, for general businesses, or for the community at large actually overlap with the work of protective guidance applicable to competitive athletes. Collegiate athlete programs have unique challenges as you progress from the D3 to the D1 level, and those opportunities for interaction, whether it be through the intensity of the sport, collective housing, the duration and the intensity of practice, the number of support staff, and the modes of travel, all start to increase those opportunities for prolonged interaction. Transitioning to the professional level, the athletic machine just gets bigger and more complex. But there is one major challenge at the pro level. All of these interactive members of the sports organization are employees. The sport is now their livelihood. And aside from the moral and the financial benefits, there is a legal general duty to exercise due diligence in the protection of these employees from potentially hazardous work environments. Sarah, I'll pass it back to you for the Q&A.
Excellent, thank you. All right, so I think this first one is relatively straightforward, and I'm going to direct it over to Dr. Baldwin. Basically, when is it safe for athletes and teams to restart play?
Great. So the considerations we're discussing today really give sports programs choice, as I said earlier, while at the same time calling out some of those inherent risks associated with those choices. So we view our job at CDC as to enable sports programs or leagues to make those informed choices by understanding the risks. So when we talk about the safety of our athletes and coaching staff on the field of play, the lowest risk really does correspond to performing individual skill building drills or conditioning at home. And the highest risk level is really full competition between teams from two different geographic areas. And as I mentioned earlier, there's a sort of a graduated levels of risk between those two extremes. So sports programs and leagues really need to remember that large events and mass gatherings can contribute to the spread of COVID-19 in and between communities. So interestingly enough, with most respiratory viruses, people are thought to be most contagious when they are most symptomatic. But we know that the virus that causes COVID-19 might spread before someone experiences symptoms. And so this poses unique challenges for us and you, and frankly, something that we really need to account for. So again, remember that each intervention alone, social distancing, frequent hand washing, cleaning and disinfection, and use of cloth face coverings offers some protection. But again, when you stack or layer these safeguards together, that's when you can lower the risk the most. I was asked recently on another call if I could assign an attributable fraction to how much protection each mitigation strategy affords or provides. In other words, what intervention will make the most difference? And I unfortunately, I can't because of the novelty of the virus and the infancy of the science on the virus. But for now, we really do need to implement as many of them as possible, especially, as I mentioned earlier, at those key times when risk of exposure is greatest. And some of our success hinges on the extent to which these behaviors are practiced with the regularity or the fidelity that these circumstances demand. And unfortunately, if recent media reports serve as a guide, we have a way to go before these behaviors become the social norms that, frankly, we need them to be. So when you consider when and how to restart play, all of this needs to be accounted for. We need to be thinking about the safety of spectators and communities, in addition to the athletes, coaches, and other staff members or personnel in attendance.
Excellent. And it's as if you read my mind, because my next question was actually going to be, when do you think it will be safe to resume play from the spectator standpoint? You know, should leagues be considering playing in an empty stadium at this point?
Yeah, great question. Very important. So again, large sporting events are examples of what we call mass gatherings. This category includes things like conferences, festivals, parades, and concerts. Jill cited this. CDC has some interim guidance tailored to venue managers and other individuals responsible for planning mass gatherings. It's dated in mid-March, and frankly, we aim to release hopefully some updated considerations this week, or if not this week, very soon. Organizers need to remember that mass gatherings, as I said earlier, really could contribute to the spread of COVID-19, including via travelers who attend these events from outside of the community in which they take place. This is a very fluid situation, so you really need to continually assess based on those current conditions whether to postpone, cancel, or significantly reduce the number of attendees if possible at an event. And this all needs to be done, again, in really close coordination with local officials. I mentioned this earlier, but there are several key factors to consider when determining the need to postpone or cancel a large gathering, and these include the overall number of attendees, the number of people attending who are at greater risk of more severe illness, the density of attendees within a confined area during an event, and the level of transmission in your local community and the level of transmission in areas from which your attendees will travel. So we recognize the draw of sports and other mass gatherings, and frankly, the tension that exists between convening these meetings and the economic and other benefits that come from it. But we need to act with an abundance of caution to help protect public health. And I wish there were easy answers, but they're not. So it's really up to us at CDC to name the risks and help you make informed choices as you balance and attend to those risks and benefits. So is it possible to hold an event but significantly reduce the number of attendees that are physically present? This, of course, would allow spectators to follow social distancing and other recommendations. In addition, is it possible to hold the event without spectators and broadcast it entirely to a virtual audience? And I know some sports are already exploring that approach. And finally, it's really critically important to make special arrangements for those at higher risk of severe illness. And those really are the most vulnerable among us. So vulnerability increases with age, especially over the age of 65, and among people who have serious underlying medical conditions. Again, these decisions need to account for those local conditions. So at minimal to moderate levels of community transmission, it's recommended to cancel community-wide mass gatherings or move to smaller groupings. And in instances where there's substantial community transmission, it is recommended to cancel gatherings of any size. So over time, as we continue to flatten the curve, the risk of community transmission will decrease, and we can slowly and deliberately relax those mitigation measures and frankly begin to fill up the stands as we all like to see.
So Grant, you mentioned different levels of community COVID-19 transmission, like minimal or moderate. Can you explain that a bit? For example, can leagues or venue managers determine what level of transmission is happening in their community? Is there a way for them to figure that out?
Sure, yeah. It's frankly a great example of why you really need to consult with your local health officials in making these kinds of decisions. We have a document on our website called the CDC Community Mitigation Framework. I'm pleased to report we released an update to that framework just last week. That document describes basically the goals, the guiding principles, and strategies for community mitigation to reduce or prevent local COVID-19 transmission. In that document, the guiding principles really serve for us as moorings to the rest of the framework and include some of the things I've highlighted a little bit already. Each community is unique. We need an admonition not to exceed public health or healthcare system capacity, and an understanding that communities need to make those informed choices scaling mitigation strategies up or down, and layering in those safeguards as we talked about earlier. It also includes a series of tables that outline the different levels of mitigation needed given underlying levels of community transmission, key demographic, community, and other characteristics to consider, and frankly, some of those cross-cutting strategies a community might implement. They're all outlined. But it's really local health officials who can determine the levels of COVID-19 transmission in a community, as well as the capacities of the local public health system and healthcare system to manage any increases in cases that might occur. And this means that in healthcare, that we have adequate staffing, a surplus of inpatient and ICU beds, and the critical medical equipment and supplies such as PPE. It also means that for public health system capacity that we have the availability to detect, test, contact trace, and isolate those who are or might be sick or who have been exposed to someone known or suspected of having COVID-19. So again, that CDC's interim guidance for mass gatherings and community events emphasizes the need to communicate very intentionally with local health authorities and other community partners when you are considering whether to host your event.
Excellent. There's a question that came through the chat box, thinking about large concerts, festivals, sporting events. Are there any best practices when it comes to encouraging social distancing, thinking about these large events, really wanting to keep people safe?
Yeah, so we recommend canceling or reducing the size of community-wide mass gatherings at a minimal to moderate level of community COVID-19 transmission. So, for example, a large gathering may include events that have over 250 people. However, the definition of a large gathering is really at the discretion of community leadership, based again on those current circumstances the community is facing and the nature of the event. Again, our job is really to help communities make informed choices. So in sporting events that includes spectators, there are steps that you can take to plan, prepare, and to proceed with mass gatherings. So they include things like meeting with emergency operations coordinators or planning teams at your venues and developing a plan to address how COVID-19 may impact, frankly, all aspects of your event, such as entry and egress, seating, ticketing, food services, lodging, staffing, security, and others. And the details of a given venue's COVID-19 should be based on the size and duration of your event, the demographic of the participants, the complexity of your event operations, and frankly, the type of on-site services and activities that you may offer. Again, I do want to emphasize the importance of maintaining physical distance between spectators and staff in your event planning, whether it is in lines, seating areas, concession stands, restrooms, and frankly, even getting to and away from the event. So again, as such, it's really important to engage community partners and stakeholders as the local public health, and that includes local public health and law enforcement officials, vendors, suppliers, hospitals, hotels, airlines, other transportation companies, as you develop and execute your plan to sort of build in those precautions that help you maintain sort of physical distance between participants.
Excellent. And should folks be concerned or be doing anything in particular when it comes to bathrooms and sporting venues?
Yeah, good question. So given that restrooms are often really a crowded area at sporting events, event managers really may want to consider specific contingency plans to maintain physical distancing in restrooms, and if necessary, limit the number of people allowed inside at a given time. So let me make a couple of suggestions of what those strategies might look like. So designating a staff member or volunteers to monitor and enforce physical distancing in and around restrooms, using markings and signage to help separate between people. So for example, indicating where to stand in line or making foot traffic flow in one direction only, redirecting individuals away from the busiest restrooms or temporarily increasing the overall number of restroom facilities. So in addition, cloth face coverings are recommended wherever physical distancing of 6 feet or more is difficult. And as Dr. Doherty mentioned, CDC and EPA have jointly developed guidance for cleaning and disinfecting public spaces, and those include guidance on restrooms. So it provides step-by-step instructions for public spaces, including restrooms. So sporting event venues should develop a plan for routine cleaning and disinfection, including regular cleaning and disinfection of high-touch areas such as doorknobs, faucets, toilets, and other restroom furnishings. So the guidance also includes some considerations about the safety of our very important custodial staff. So they are at increased risk of being exposed to the virus, as well as any toxic effects associated with cleaning chemicals. So they should, of course, wear appropriate PPE. So to protect your staff and to ensure that the products are used effectively, staff should be instructed on how to apply the disinfectants, again, according to the label instructions and any other precautions.
Excellent, thank you. And before I switch gears over to the subject matter experts, I'll just ask one more question of you, Grant. I know you've made a few comments about concessions and foods within sporting venues. Can you talk a little bit more about that and specifically what folks might want to consider when it comes to dining halls and cafeterias for staff?
Yeah, thanks, Sarah. I think I'll be a little bit briefer here since I feel like I've talked for a good while. So I'm going to point you to CDC's considerations for restaurants and bars. So many of the principles and suggestions included there will also be relevant to staff cafeterias or concessions. I'll also point you, the Food and Drug Administration has a best practices for retail food stores, restaurants, food pickup and delivery services during the COVID-19 pandemic. I think those can be of great assistance to you. Those resources include a checklist, a great infographic designed to assist retail food establishments that might have been closed or partially closed during the COVID-19 pandemic and are in the process of preparing to reopen. Again, those materials are available by searching the CDC website and use the following search term: best practices for reopening retail food establishments during the COVID-19 pandemic.
Excellent, thank you. So switching gears, thinking about athletes being exposed, I'm going to ask Jill a question. Thinking about how different sports have different exposure risks, are individual sports considered to be safer than, say, team sports? And for example, even let's say a sport like running. Do you have any feedback on that?
Yeah, absolutely. This is an important consideration. The risk of COVID-19 exposure and spread can be different between sports depending on the type of activity. So activities that require close interaction and sharing of equipment probably carry a higher risk of exposure and spread than activities that can be done alone or with smaller groups and those that don't require the sharing of equipment. So as we've already mentioned, a general principle we like to follow when we're thinking about these issues is the more people a player interacts with, the closer the physical interaction is, the longer that interaction, and the more sharing of equipment, the higher the risk of the COVID-19 spread is likely to be. So sports that require frequent closeness between players may make it more difficult to maintain social distancing and therefore probably present increased risk for COVID-19 spread compared to sports where players are not close to each other. So for close contact sports like wrestling or basketball, play may be modified to safely increase distance between players. For example, a sports program might consider focusing on individual skill building or conditioning versus competition. They could also consider limiting the time players spend close to one another by playing full contact only in game time situations. Or you could think about decreasing the number of competitions during a season. So those are just a few strategies to think about.
Excellent, thank you. I'm seeing in the box there's a question, is there any specific guidance associated with high school sports versus professional sports, amateur sports? Maybe I'll throw this at Ken to start us off with this one.
Sure, thank you. So much of the youth sports guidance that we talked about earlier is applicable to other levels of athletics. But there are some differences, of course. As athletes age and mature, more of the responsibility or the emphasis is going to fall upon them to follow certain rules for social distancing and washing their hands and those kind of things in their environment that they can control. The nuance of responsibility between collegiate and professional athletics is a little different. It's worth noting because since the exposure within professional athletics are occupational exposures, which employers expected to have a reasonable responsibility for providing worker protection for that scenario.
Yeah.
Jill, did you have a comment here as well?
Yeah, I just wanted to jump in and just piggyback on what Ken is saying. So for collegiate athletes, CDC's considerations for higher education suggest the following strategies, which are in line with what we're talking about today, namely pursue virtual group events, gatherings, or meetings if possible, and promote social distancing of at least 6 feet between people if the events are held, and also to limit group size to the extent possible. Pursue options to convene sporting events and participate in sports activities in ways that reduce the risk of transmission of COVID-19 to players, families, coaches, and communities. And also limit any non-essential visitors, volunteers, and activities involving external groups or organizations as much as possible, especially with individuals who are not from the local geographic area, for example, the same community, town, city, or county.
Excellent, thank you. Ken, what screening should we use for players and staff?
Like other organizations and businesses, sports teams may consider conducting daily in-person or virtual health checks, looking for symptoms or temperature screening of their players and staff before they enter the team facility. Of course, they're going to want to follow the state and local public health authorities and your occupational health services in that activity. If implementing in-person health checks, then it's going to be important to conduct them safely and respectfully. You're going to want to remember to maintain social distancing and barrier or partition controls during those testing activities, and use personal protective equipment as necessary to protect the screener. However, reliance on PPE alone is less effective of a control method, and it's also a little bit more difficult to implement. So given the PPE shortages and training requirements, you should complete the health checks in a way that helps to maintain social distancing guidelines, such as providing multiple screening entries into the building. Follow guidance from the Equal Employment Opportunity Commission, which is regarding confidentiality of medical records from health checks. And to prevent stigma and discrimination in the workplace, make employee health screenings as private as possible. Do not make determinations of risk based on race or the country of origin, and be sure to maintain confidentiality of each individual's medical status and history.
Excellent. And another question for you, Ken. Should we be testing all players, for example, before games?
Oh, that's probably a common question. In general, CDC does not currently recommend that viral or serologic test results be used for decisions of admitting or excluding persons from settings like schools or workplaces. The viral tests only determine potential infection at the single point in time, and so you may miss cases in the very early stages of infection. Positive test results may be more likely to be false positives in communities that have low rates of community transmission. While the presence of anti-SARS-CoV-2 antibodies likely indicates a prior infection, until we know the durability and duration of immunity and that until those items are fully established, it cannot be assumed that individuals with truly positive antibody test results are protected from future infection. Persons who test positive by serological tests should continue to follow the CDC recommendations to prevent infection with SARS-CoV-2. Testing of athletes and staff for COVID-19 may be appropriate in the limited context of case investigations and contact tracing. For example, following the identification of a positive case in an athlete or coaching staff member, CDC contact tracing guidance encourages states with available resources to test high-risk contacts of the confirmed case. In general, CDC currently recommends testing under several scenarios subject to the guidance of state and local health departments and the judgment of treating clinicians. This includes testing individuals with symptoms consistent with COVID-19, as you might identify through your symptom screening. Testing asymptomatic individuals with known or potential exposure to SARS-CoV-2, such as during case investigations and contact tracing. And then testing to determine resolution of infection. Can you discontinue home isolation or discontinue the work exclusion activity?
So when we're thinking about an athlete or a staff member that's sick, how should we be responding to this? And I guess I'll first hand this over to you, Jill, to hear some thoughts, and then I'd love to hear what you have to say as well, Ken.
Yeah, Sarah, I'm glad that you're asking that question. Making a plan in in advance is going to make your response smoother and smarter. In general, a good plan should follow the guidance and direction of state and local health authorities and would include steps for how you would address a couple of issues. First of all, ensuring that coaches, staff, officials, players, and families know that sick individuals should not attend sporting activities. Second, safely transporting anyone who is sick to their home or a healthcare facility. Third, provide education on what to do if you're sick in coordination with local or state health authorities, identifying those who have had close contact with a person diagnosed with COVID-19 and advising them to stay home and self-monitor for symptoms. And note that steps should always be taken to maintain confidentiality in accordance with applicable law and regulation. Fourth, advising individuals with COVID-19 about home isolation and how to know when it is safe for them to end their home isolation. Team members or staff with COVID-19 shouldn't return until they have met CDC's criteria to discontinue home isolation. And then lastly, make sure to close off areas that were used by the sick person and not using those areas until after cleaning and disinfecting them. And I also want to check in with my colleague, Dr. Mead, to see if he wants to add anything from the worker safety perspective on this question.
Thank you. I agree a lot with the importance of planning ahead. And I do want to clarify, however, that there's a difference between a sick athlete and an athlete with COVID-19. When someone is sick, either self-identified or through screening, they should stay at home, or if they're already at the facility, they should leave immediately. Evaluation by a healthcare provider can determine whether or not the sick person actually has COVID-19. A positive test result for COVID-19 should trigger a series of immediate protective actions, which would include isolation of the COVID positive person, contact tracing and quarantine of potentially exposed contacts, and lastly, through disinfection of potential shared spaces in which the COVID positive person recently occupied.
Excellent. And Ken, what protocols should be followed for leagues that span across more than one jurisdiction?
So local authorities having the jurisdiction for the local area, they're going to have the final say on the minimum levels of protection and protective activities. However, if the sport or the league protective policies are more stringent than the local requirements, then they should continue to follow those as well.
Excellent, thank you. Jill, how do we promote physical distancing between players during practice or competition?
That's a really great question. So of course, CDC does encourage social distancing in sports programs if feasible. And there are several general strategies to do this, which may or may not apply based on the nature and level of sport. So for instance, programs could identify a staff member or volunteer to help maintain distance among their players, coaches, umpires, referees, and spectators, if state and local directives allow for spectators. They could also space players at least 6 feet apart on the field while they're participating in the sport. For example, during warm-up, during skill building activities, or doing simulation drills. They could also discourage unnecessary physical contact, things like high fives, handshakes, fist bumps, or hugs. If keeping physical distance is difficult with players in competition or group practice, they could consider relying on individual skill work and drills instead. A league or program could also provide physical guides, such as signs and tape on floors or playing fields, to make sure that coaches and players remain at least 6 feet apart. They could also limit the use of shared transportation. If practices or competition facilities are shared, it's possible to add buffer times between each team's entry or exit and clean and disinfect facilities between use. Some programs are deciding to cohort their players in small groups with dedicated coaches or staff and make sure that each group of players and coaches avoid mixing with other groups. Teams might consider staging intra-team scrimmages instead of playing games with other teams in order to minimize exposure between players. And then it's also possible to stagger times or locations for each cohort to limit contact between groups as much as possible. If organizations are not able to keep in place safety measures during competition, for example, maintaining social distancing or keeping players 6 feet apart at all times, they may consider limiting participation to within team competition only. For example, scrimmages between members of the same team or team-based practices only. Similarly, if organizations are unable to put in place safety measures during team-based activities, they may choose individual or at-home activities, especially if any members of the team are at high risk for severe illness from COVID-19.
Excellent, thank you. Should we be spacing people out on the sidelines, including on benches or in dugouts?
So I would say you're going to know your program and sport best, and there are likely different approaches for different sports, but you can consider using signs or tape marks or other visual cues such as decals or colored tape on the floor, placed 6 feet apart to indicate where to stand when physical barriers are not possible. You could also consider assigning staff or another leader to remind players and staff to maintain social distancing.
Excellent, thank you. We've received a couple questions about breathing, sports that have heavy breathing associated with them, exercising. So curious, Ken, if maybe you could share, is more than 6 feet of social distancing needed when playing those types of sports or involved in those types of activities? How much would you recommend should be considered?
So as you mentioned, COVID-19 is transmitted person to person through respiratory droplets, and the studies and the evidence on infection control report that these droplets are going to travel around 6 feet, 2 arms lengths. And this is why the big importance and the focus on social distancing as well as cloth face coverings are important. It is reasonable to assume, however, that under heavy exertion or rapid deep breathing, that the resulting aerosol distances or the generation, it might be different than that for the general public under a day-to-day activity. So it could be greater than 6 feet. It's not really known. Social distancing, however, increases the dilution between the source and the potential recipient. So generally speaking, more distance is better, but we're unable to identify a minimum distance that's always going to be safe under all circumstances.
Thank you. Jill, is it safer for athletes to train outdoors instead of indoors at this time?
Yeah, there's definitely some evidence to suggest that prioritizing outdoor activities over indoor activities is recommended in order to decrease the risk of COVID-19 transmission. If you are playing inside, you could consider ensuring that ventilation systems operate properly and increasing circulation of outdoor air as much as possible. That might help. However, I do want to say that you should not open windows and doors if doing so poses a safety or health risk. For example, if there's a risk of triggering asthma symptoms to players or others using the facility. If you're playing outside, keep in mind that additional health and safety implications beyond COVID-19 may apply. For example, pay attention to the temperature, ensure personnel are properly hydrated and dressed, and monitor players and staff to prevent heat-related injuries or illnesses, which is really important now that we're going into the summer season.
Definitely. Going back to this idea of maintaining 6 feet distance, I'm curious, Jill, do folks need to close down locker rooms or gyms if athletes can't maintain that distance?
Great question. So we talk about this in our youth sports considerations document, and this falls under the healthy environment bucket. So sports programs may consider modifying layouts to promote physical distancing, including by closing communal use spaces such as locker rooms, or restricting the number of people allowed in at one time to ensure that everyone can stay at least 6 feet apart. Other considerations that are related to this include cleaning and disinfecting frequently touched surfaces or shared objects and equipment, at least daily or between use, providing physical guides such as signs and tape on floors or playing fields to ensure that coaches and players remain at least 6 feet apart, and also ensuring ventilation systems operate properly and increasing circulation of outdoor air as much as possible. And with regard to your question about the maximum number of players or staff allowed in an area, CDC has not set any specific numbers for these situations. In general, the number that is chosen should allow for appropriate social distancing or cohorting as decided by each individual sports program. And this will depend on whether the activity is indoors or outdoors, the age of the player, the level of spread of COVID-19 in the individual locality, and the type of sport played.
Excellent, thank you. So CDC recommends delaying or canceling non-essential travel. Can you clarify how this applies to athletes and teams that must travel frequently for competition? Should they cancel those games then? And I'll pose that to Jill.
That's a great question. So as the country continues to reopen, decisions on when and where to travel should be based upon risk assessment of the affected communities. In general, traveling outside of the local community may increase the chance of exposing players, coaches, and fans to COVID-19 or unknowingly spreading it to others. This is the case particularly if a team from an area with high levels of COVID-19 competes with a team from an area with low levels of the virus. So to reduce the risk of spread, sports programs may want to consider competing only against teams in their local area or decreasing the number of competitions during a season, limiting the participation to staff and athletes who live in the local geographic area, or limiting other activities involving external groups as much as possible, especially with individuals from outside of the local geographic area. And I just lastly want to say that COVID-19 cases and deaths have been reported in all 50 states at this point, and the situation is constantly changing. So when you're considering traveling away from your local community, the athletes, coaches, and staff, you may want to ask, is COVID-19 spreading where you're going? Is it spreading in your community? Will you and those you're traveling with be able to maintain 6 feet of social distancing during and after your trip? Are you or those you're traveling with more likely to get very ill if exposed to COVID-19? Do you live with someone who's more likely to get very ill from COVID-19? Does the state or local government where you live or at your destination require you to stay home for 14 days after traveling? And then lastly, if you get sick with COVID-19, will you have to miss work or school? So lots to think about when you're making these decisions about travel.
Excellent, thank you. So continuing with this theme of travel, how should a team, or what should a team consider rather, that typically travels via a group bus or a plane?
So travel groups should be limited to just the screened cohort of athletes and then the support staff that travels with them. And the mode of travel should be considering of distance as well as the increased exposure that may occur if you're using multiple modes and have to switch from one to the other. When exposure to the general public or unscreened people is unavoidable, such as perhaps through an airplane terminal, then face coverings, social distancing, and minimized exposure periods should be encouraged.
Excellent. Thanks, Ken. And another question for you. There are some players and staff that have shared housing for training camps and travel. How should they go about setting up these situations safely?
Well, once the initial screening and the effective sequestration and protection of athletes and the support staff, once you've successfully implemented that, then concepts such as shared housing for training camps and travel should not introduce a significant risk. It is also important to continue your everyday prevention activities, however, such as frequent hand washing, covering coughs and sneezes, and avoiding sharing objects such as towels.
Excellent, thank you. I'll throw another question at you, Ken. Can COVID-19 be passed through sweat? And with that in mind, how would one clean or disinfect a locker room or gym?
Sure. So as a reminder, COVID-19 spreads mainly from person to person through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. And these droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. There is no evidence to date that indicates that transmission of COVID-19 has occurred through exposure to body sweat of an infected person. However, CDC continues to encourage frequent hand washing, and frequent disinfection of high-touch surfaces to include exercise equipment. Regarding the question on cleaning and disinfection, follow the cleaning and disinfection guidance from CDC and EPA that we mentioned earlier. Clean and disinfect frequently touched surfaces at least daily or between uses as much as possible. Shared objects and equipment should be cleaned and disinfected before each individual if possible. Develop a schedule for frequent cleaning as well as routine cleaning and disinfection. Ensure that the disinfectants being used are effective against SARS-CoV-2. You can find a list of products on the EPA website. Also be sure to follow the manufacturer's instructions. Discourage the use or sharing of items, discourage the sharing of items that are difficult to clean, sanitize, or disinfect. Also, definitely don't let your players share towels or clothing or any other items they may use to wipe their faces or their hands.
Great, thank you, Ken. And I think that kind of rounds out the hour. Typically, we wrap up these calls, for those of you who have called in the past. We normally do it at about 4:45, but today, since we had so many great questions, we decided to prolong it a bit. So I will turn things over to Dr. Baldwin and see if you've got any closing remarks or additional thoughts before we wrap up.
Well, thanks, Sarah. I just wanted to express my appreciation for everyone joining the line today and the robust dialogue that we've had. Please feel free to reach out to CDC if you have additional questions. We are here in service to you. And again, thanks for your commitment and all you're doing to keep our sports venues and our athletes safe.
Excellent, thank you. And yes, thank you everyone for joining today. As I mentioned earlier in the call, this call was recorded and it'll be posted online and available for your listening and viewing pleasure in the future. As a reminder, this call takes place every Monday. If you've got any questions about these calls, don't hesitate to reach out to us. Our email is eocevent377@cdc.gov. Thank you again for your participation, and we hope to hear from you next week. Bye-bye.